Hi, I'm Carolyn Zaumeyer, nurse practitioner here at LowTE, Florida. I have the pleasure today to have Dr. DeSilva visiting with us to help me explain nutraceuticals and how they come together with our pellet therapy to give you the best result. We want to promote not only good hormones, but good health, and they all come together and work together. And so we're going to go through our supplements that we most likely would recommend to you, and we'll go over each one and show you how they tie together. Dr. DeSilva is a nutritional guru in my world. I've studied under him for years and think he's absolutely brilliant. So I hope we can explain things to you today that are going to be crystal clear so you'll understand why you come in to get your hormones fixed and you end up with a bag of supplements leaving the building. I feel like sometimes that's a little odd, that you come in for one thing but end up with another. So we're going to explain how it all ties together. So Dr. DeSilva, thank you so much for coming.
My pleasure. Thank you for the invitation. And I really want to just briefly mention what you just, elaborate on what you just said. What people have to understand is that hormones are part of the way the body works. In order for hormones to work the way they do, there are certain cofactors. There are helpers, if you will, that enhance the effect of the hormones. So that's why what you said is so critical. B vitamins, vitamin D, DIM, these all work together. If you just gave somebody hormones, okay, that's okay. But don't you want to boost the octane in the engine? And that's exactly what happens with the supplements.
I had a guy early on when I was first pelleting. He came in, we optimized his hormones. They were perfect on the labs, and he comes in at 6 weeks saying, I feel nothing. And I said, well, are you taking the supplements that I recommended? He said, no, I bought them all. And I said, well, buying them and taking them are two different things. So go home, dust them off, and start taking them, and come back and see me in 2 weeks. He walked in with his arms up, feeling like Superman. He said it finally all came together. So a lot of times when people aren't having what they thought they were going to have as an experience with the hormones, when I ask, how much DIM are you taking? Oh, I don't need that. Yes, you do. Right. So let's start with DIM.
Sure.
LowTE DIM, one of my favorite products. I recommend it to everybody on hormones. It helps the hormones metabolize down the safest pathways. It helps your hormones just work better, last longer. So Dr. DeSilva, please share with us more about DIM.
So DIM stands for diindolylmethane. It is an extract from cruciferous vegetables. Now, this is not, you're not getting a bunch of vegetables in here. You're getting the extract from the vegetables. Let's talk about men first. What DIM does in men, it's called a natural aromatase inhibitor. When we pellet somebody, we put a man, when we put testosterone into that man, what happens is that sometimes that testosterone will get converted to estrogen. We don't want that to happen. We want testosterone to stay as it is in the form of testosterone. And that is exactly what DIM does. It prevents the aromatization or the changing from testosterone to estrogen.
I make it pretty clear to the guys that they need to take this twice a day to help prevent man boobs, belly fat, feeling sluggish and tired, and prostate problems down the road. It's very protective for the prostate.
Absolutely. And this is how I get my patients to take the DIM that I have that are on testosterone. I say to the guys, and please excuse this, do you want breasts? If you don't want breasts, you have to take this because it's exactly what you just said. That aromatization process, that conversion of testosterone to estrogen will make your breasts enlarge. It will change your mood. It will increase the size of your belly. So there's all of these things. And this is something that is critical to prevent that from happening.
Yeah. Men need a little bit of estrogen, but not a lot.
Correct.
They
Correct.
have to have some, else they're not going to feel well. And a lot of guys, when they see it on their lab report, they're like, why are you testing, the estrogen? Well, it's very important that we see where those levels are because we don't want it too high.
Right. And it's the same thing that we want for women, right?
Yes.
We want a little bit of testosterone in women. So what DIM does, or what the diindolylmethane does in women, is that it sends estrogen down the right pathway. It's exactly what you just said. It's protective for the breast tissue. It's protective for the ovaries, for the uterus, for the cervix, and it raises the free testosterone just a little bit in women also. So there's no, and I cannot tell you, and I've been teaching courses and talking about this for almost over 25 years. How many people, men and women, that are on bioidentical hormones have no clue what DIM is?
Yes.
That just completely blows my mind that they're not on this.
I see them coming to me from other providers, and I'm like, well, are you taking DIM? And they're like, well, what's DIM?
Right.
And so then I go into it, that it helps actually, it's very supportive and protective for the breast for women, to
Right.
help prevent breast cancer. So it's very important that women take 1 a day, men take 2 a day.
And I love also what you said about the prostate. It is very protective for the prostate tissue in men. So there's no question about it. This is a must.
Yeah.
This is a staple that anybody that's doing hormones needs to be on.
Absolutely, absolutely. But I think we've covered DIM pretty
Yes,
good.
yes,
All
absolutely.
right, let's move on to our next two. And they look alike. They're ADK and ADK10. And what that means, it's vitamins A, vitamins D, and vitamin K, all put together to work synergistically to get the best benefit for your vitamin D, which helps with your bones, your mood, it helps with your teeth, and it helps with your immune system.
Absolutely. So, and again, why do we have A, D, and K in here? Most nutrients work in a triad. Like, for example, for calcium metabolism, you need magnesium and vitamin D. For vitamin D metabolism, you need vitamin A and vitamin K2. So most of these vitamins and minerals work synergistically. That's number one. Vitamin D, and this is 5,000 IU and this is 10,000 IU. Vitamin D, as you mentioned, is one of the most critical nutrients that you can take. Immune health, brain health, heart health. It's great for your teeth, as you said. And why is there vitamin K2 in here? The reason that there's vitamin K in here is that vitamin K acts as a gatekeeper. It's a traffic signal. It's a police officer that says, calcium, you go over here, and vitamin D, you go over here. So if you didn't have K2 with the vitamin D, there would be no direction as to where the vitamin D and or calcium would need to go. And that's where the problems begin. It would arbitrarily, calcium and vitamin D would then arbitrarily deposit throughout the body and produce a myriad of problems.
Yeah. Yeah, and the A helps with the absorption,
Yes,
correct?
excuse me. Yes, I forgot to, yes, absolutely. So vitamin A is a carrier. It's a carrier molecule that takes the vitamin D in. Remember vitamin A and D ointment when our kids were little and they were growing up?
Yeah.
Vitamin A and D ointment was something that we used for diaper rashes and things like that. And the reason the vitamin A was in there is vitamin A, first of all, is wonderful for the skin. It is incredible for the skin. And by the way, and I don't know if I've ever mentioned this to you before, so I'm glad we're doing
here's a
this.
new nugget.
Yeah,
Here
this is
we
a new
go.
nugget. So on the back of your arms, a lot of people have those little bumps, those little lumps and bumps on the back of their arm. Looks like prickly heat.
Yeah.
That is a vitamin A deficiency.
Wow.
So that's what I just said. Vitamin A is tremendous for the skin. So you will see that once you start using the A, D, and the K2 together, you're going to get that improvement in the back of the arms, and those little bumps and lumps are going to go away.
That's a good new little
Yeah,
nugget.
that's
Thank
a
you
new
for
little
sharing.
nugget.
That's
Sure,
great.
sure.
So we covered our ADK and ADK10, so that's very good. That's very important. It's really interesting to me. I read a lot of research articles, as you do as well, and many times one of the common things I pull out of that for all these different disease processes is you're more prone to it if you have a low vitamin D.
Oh, yeah.
And it just pops up here, and then there were studies about with COVID, everybody that was being admitted into the hospitals all had low D, to the point that they were just shooting them up with D as soon as they came in.
Right. Well, believe it or not, on that note, I said immune health, right? Vitamin D is critical for immune health. The studies they were referring to, what you just referred to, was in the African American population. What they noticed was that the mortality was much higher. One of the factors, and I'm not saying all the factors, but one of the factors was that their D levels were so low. It is very well documented that in the African American population, D levels, over 95% of the African American population is deficient in vitamin D. and which contributed to their morbidity, not only morbidity, but also to their mortality.
Right.
So fixing your vitamin D level, and by
Yeah.
the way, between 60 and 80, right?
Yes, that's our goal on the
Right.
labs.
We
yes.
want optimal, we don't want normal.
Yes.
Because normal is a risk factor for disease. We want optimal,
Exactly.
which is the level between
Yes.
60 and 80.
A lot of people say, I'm sure my D's fine because I play tennis every day here in South Florida. And then I'll test their labs and it'll be like below 30, below normal, the normal or reference range on the labs. And, even though we love our sun here, our boat, the beach, everything, we still need to check our D levels and check them yearly, right?
Absolutely.
You don't want
Absolutely.
too much and you don't want too little.
Absolutely. And what's interesting is that I see patients here in Florida. I've seen patients in the Caribbean, in Puerto Rico, and their levels, they're in the Caribbean, you're living in Florida. Why are my levels low? Well, sunblock, you're wearing long sleeve shirts, you're always wearing a hat. Yes, you need to protect yourself from the sun. And if you have, God forbid, some skin cancer or something going on, your dermatologist says, don't go in the sun. Don't go in the sun.
Yeah.
That's where the supplementation, but this is for everybody. Absolutely.
Absolutely. That's why we include that on our original panel, and then we test it
Yes.
once a year. Iodine. Whenever I have a patient that we're optimizing their thyroid, because we test labs for the thyroid as well as the sex hormones, when I optimize their thyroid, I always encourage iodine. And iodine is a very important part of your body that helps you create thyroid, correct?
Correct. Correct. What iodine does, and by the way, here's a little piece on why. In the 1960s, iodine was taken out of bread and pasta. Bromide was introduced into the bread and the pasta. What that caused was bromide is very similar to chlorine and chloride. What that did was that it displaced all of the iodine from the thyroid gland, and we saw this massive increase of underactive thyroids. Why? Because iodine was taken out of the bread and the pasta and some of the baked goods. Iodine is so critical for the thyroid, but the greatest concentration of iodine is not in the thyroid. The greatest concentration of iodine is, where do you think it is? It's not the thyroid, it's in breast tissue. So women with fibrocystic breast disease, women with ovarian cysts, uterine cysts, the way I treat them is I give them iodine. Now, I send them to the gynecologist, make sure there's no malignancy here, there's nothing bad going on here in the uterus or the ovaries. If they say they're benign cystic disease, do the iodine.
Absolutely.
And what iodine also does is that iodine converts the inactive form of thyroid, which is T4, converts it to T3.
So you get more of the bioavailable active thyroid that's going to help with your metabolism for your weight, your hair, your heart, your skin, all kinds of different things. It's like the master conductor of the orchestra. It takes care of your whole body. So that's very important that we do this. And most people are deficient in iodine because they did take it out of our food, out of our salt even. There was, remember the Mortons, they took it out of there.
The
now
iodinized salt.
You can buy it separate, but you told me years ago that, every said, oh, I eat salt, I have iodine salt. Once you open that carton, the iodine disappears within a month, right?
Yes.
And who eats? Oh, you better not
Right,
be using
right.
that much salt
that
in
much
a
in a
month.
month. True, true.
So yes, so that's a very good supplement.
But one other thing before we go on the iodine, we have to also be very careful not to do this very quickly. And I
Yes.
know we talked
Yes.
about this. When you start iodine, you have to start it slowly because people are so deficient. If you load too fast, what's going to happen is you're just going to feel absolutely awful.
Get flu-like symptoms.
Exactly.
Right? Yeah.
There are flu-like symptoms, and you nailed it before we started taping. You said, I think you said you start one a week.
We start very slow. The very first week, our protocol is the very first week you take one capsule. Let's say you take it on a Monday. The next week, you take one on a Monday and one on Friday. So you've got 2 in that second week. The third week, 3, Monday, Wednesday, Friday. And then you build up to just 5 and never take more than 5 a week. So you have 2 days off. So you can pick which days you want off.
Exactly.
But we go very low and slow because a friend of mine didn't do that and started taking them every day and was on vacation in Aruba and ended up spending the whole weekend in her room feeling sick when she was in Aruba.
And that's exactly what this
don't do
does
that.
And by the way, these two work together when it comes to hormones. What this does is that DIM and iodine also tells estrogen in women to go down the right pathway.
The 2-hydroxy pathway.
The 2-hydroxy pathway.
Yeah.
We need to have both of these to push that estrogen down the right pathway to protect the breast tissue, uterus, and ovaries.
I don't know if this is a good analogy, but I tell my patients that what it does when it's pushing it down the right pathway, to picture the lotto balls that are bouncing up here, they can land this way, or this way, but this pushes them down that right pathway so that we get the best, safest use of our estrogen.
I think that's a wonderful analogy.
Oh, good.
No, but seriously, that's
Yeah.
exactly what's happening.
Yeah,
and that's a great
the
visual.
estrogen has the option to go down these pathways, and one of them's not so good, or a couple of them aren't
Right,
really
two
that
of them
good.
are not so good.
Yeah,
Right.
so to get it to push down the right one is good.
Perfect.
Yeah.
So
Okay.
I just wanted to point that out, how they work together.
Okay, now methyl factors. Methyl factors, we need to talk about methylation because some people know about it, but a lot of people don't. And there's a specific gene that some people are testing for and finding out that they are not able to process their B vitamins properly. So please share with us more about methyl factors plus and methylation.
Sure. Methylation is one of the most critical processes within the body. It has to do with brain health. It has to do with heart health. About 60% of the US population can't methylate, which means you have to make sure that you're taking the right kind of B vitamin. You cannot take cyanocobalamin, you have to take methylcobalamin. And also, it's the same thing with folic acid. You cannot just use folic acid, you have to use methylated folate. Why is this such a big deal? Well, let's talk about it on two fronts, actually three fronts. Number one, let's talk about it with regard to the hormones, right? When it comes to hormones, if you don't have B vitamins, you cannot make estrogen. So you have to have the right B vitamins in the right amounts in your body to make estrogen. What you're doing, and we said this in the beginning, you're optimizing, I'm giving you estrogen, but now I'm telling you where it needs to go, and I'm telling you this is how it is made. These are the cofactors. These are the ingredients that allows these to work and do what they're supposed to do. So that's one. Number two, people that have low methylation or they have this MTHFR break, it's a genetic defect, if you will, and not a big deal, but you need to know about it. If you have that MTHFR break and you don't take the right form of B vitamins, which is B12, B6, B12 folic acid, you increase your risk for heart disease. So your homocysteine level will go up and you increase your risk for heart disease. One other little caveat is that there's also a very strong correlation between people that can't methylate and Alzheimer's disease and dementia.
Wow.
So the studies have shown that if you have high homocysteine levels, which means you're not methylating properly, you're at greater risk for developing dementia. So this isn't just about hormones, right? This is about the whole body.
Good
This
health.
is the heart, this is the brain, this is everything.
Good old age.
Yes, and aging
That's what we all
properly.
want, you
Exactly,
know.
exactly.
What I tend to recommend it for is when I see that somebody's low on their B12. They usually are coming into me with fatigue, low energy, I don't feel well. This will help give them that boost. I recommend it 1 to 3 a day, and I tend to take one after lunch for a little pop,
Yes.
just to help me through the afternoon. But it is an energy vitamin is how I describe it, and if I do see that they're low in their B12, I do recommend this, and they do say that they feel much better. It also is good because most of my patients come in here with fatigue, coming in for hormone replacement. You would think that the libido and the sex part would be what draws them into LowTE Florida, but honestly, it's more fatigue. We're tired of being tired. We just don't. After our hormones are declining, we just don't feel well. We don't feel like our old selves. So after the treatment, it takes 4 to 6 weeks for those hormones to optimize. during that time, if they're taking their methyl factors, they're going to feel that better energy and just feel better. So
You're
that's why we
absolutely
encourage
correct.
that.
And one other little piece in there is a lot of people that come in that have low testosterone levels, they're usually a little bit overweight and they may have some blood sugar issues. So a lot of these folks are also going to be on things like metformin. Well, metformin depletes, I mean just rips vitamin B12 right out of the body. So anybody that is on any kind of an oral hypoglycemic specifically, and what I mean by oral hypoglycemics are medications, prescription medicines for blood sugar.
Right.
Make sure that you know your vitamin B12 levels.
Absolutely.
Because metformin is just going to deplete that out of the body, and this becomes critical.
And I have a good number of patients on metformin, and they're also on the injectables.
Yes. Some of the other drugs, they're not as bad as metformin.
Right.
In fact, this data was reported in, I'm not sure whether it was British Medical Journal or Lancet. It was reported in Lancet about 7 years ago, and it really hit the news. But this is critical.
It's a good one. It's a good one. Now this one, both you and I get all excited about our probiotic. It's our favorite. Well, if you have a favorite, that's our favorite little baby. Because you have to, what the probiotic, I didn't believe in probiotics until I met you. I really didn't. And then I started studying, and I grew up working in surgery, and so I'm very visual. So I needed to see what was going on. And finally, I saw a cross-section of the intestines of people with a good lining of their intestine and those who have not done any repair with the probiotic. And it looks like a golf turf, like a putting green, when it's healthy, all tight little grasses. And then through exposure to antibiotics, the stuff they put in our food these days, you know, all the chemicals in our world, that weakens and doesn't give you the protection. And so when we take this, we're trying to repair and replace that lining and getting it nice and healthy. And why is that important? It's good for our immune system. How much is based in the gut?
70%.
70% of your immune system is based there. So to prevent colds and flus, you know, or COVID or whatever, you need to have a healthy immune system. And then also it helps with digestion, elimination, burps.
And anybody with gas, belching, bloating, burping, right? This is critical. This probiotic is my number one recommendation for good health. From birth, this is an adult formulation. They have pediatric formulations. But this to me is critical. So there's 4 functions of the probiotics. Number 1, as you mentioned, is immune health. 70% of our immune system resides in our intestine. Number 2, digestion. How many people are taking the acid blockers? Those folks are deadly. They're absolutely deadly.
Those are like the omeprazole, the Pepcid, that type of thing.
Yes. And in fact, when you change the pH of your stomach, you cannot absorb minerals. So you can't absorb calcium. You can't absorb magnesium. So what does that now do? You increase you can't sleep. You have muscle twitching. You have muscle aches. You have people, their blood pressures start to go up. There's a host of problems that occur when you take these acid blockers over a period of time.
Absolutely.
So immune system, digestion, elimination. How many people in this country are constipated? Folks, you want to get rid of the constipation? It's the probiotic. That's what you need to do. And then last but not least, the probiotics, the good bacteria, make the B vitamins. So you have to have the good flora. So not only the B vitamins, but vitamin K2. So these all work together.
Like we said in the beginning.
Just like we said it in the beginning.
And you have to have a good, healthy gut to absorb all the good nutrients from our food, from our supplements, and for our hormones to function properly.
Absolutely. And then what makes this different, right?
Oh, we know what makes us different. It has the 3 most studied microbiota.
Exactly. She's been listening to me for too long, folks.
It has a patented capsule that opens in the beginning of your small intestine instead of your stomach. If you buy a probiotic from the grocery or Whole Foods or wherever, and you take it and it opens in your stomach, that stomach acid can kill all that good millions and billions of microbiota that you just swallowed. So it doesn't get a chance to repair and replace and fix your flora of your intestine. So that's the most exciting part about the patented capsule.
I have nothing else to say. That's it. I'm leaving now.
We love our probiotics, and I notice if I miss one.
Mm-hmm.
You know, I take it morning and night, and I notice if I miss it.
Absolutely.
You know, it's just like it makes me feel good.
Your bowels will work better, your digestion is better, your immune system is enhanced. There's just so many benefits. And in fact, the gut is called the second brain.
That's right.
Right? It's the second brain. So
Keep it
phenomenal
healthy.
stuff.
Now, here's our LowTE free TE.
Yes.
And this is my baby. This helps.
Well, you can tell me all about this.
Okay, this is a capsule made from a root extract from Malaysia, Tongat Ali, Uracomycin. And what it does, your liver produces a protein called the sex hormone binding globulin, and it can attach to your hormones. And when it does that, your numbers may be perfect on the labs, but you're not feeling it. You're not feeling the love. You just don't have what you were hoping to get from your hormone optimization. When you take these, I recommend patients, if they're not doing well with it, they don't have to take it. It's an optional add-on. But if you take 2 in the morning as a regular supplement, you're always going to have that bioavailable testosterone so that you're feeling really good. And then take 2 more, like a half hour or hour before exercise or intimacy, and it frees up that testosterone so you get all those good results that you were hoping for. So free TE, I take 2 in the morning as just like a regular supplement, and then add a couple in whenever you feel like you want to have a little bit more. You can take up to 6 a day safely. You know.
And the other thing is, this is also, it has an aromatase-like effect, right? So it prevents the conversion of testosterone to estrogen, but it's exactly what you said, is that what this does is we don't, and this is the same thing with thyroid, by the way, we don't want your thyroid hormones stuck to proteins. We want them to be free. We want them to be able to float around and do what they do. That is very, very important when it comes to testosterone. We don't want it bound up. This unbinds it and frees it so that it is able to do what it needs to do.
And you can get back that loving feeling.
Absolutely. We always love that love and feeling.
A little bit with the libido
Yes.
here. So
Yes.
this is it. This is our wrap up of today's talk. And I would just want to thank you so much. Is there anything else you want to add?
Just to say thank you.
No,
You know,
thank you.
I love being with you. Seriously, I really
Yes.
love being with you. You've been so amazing and so supportive, and I really appreciate it. No, we all do, and
It's
thank
a little
you.
love fest here.
Yeah, thank you. Thank you very much.
Thank you for coming.
My pleasure.
Yeah.